Hello there, this is Dr. Mintz. This is a case of a 68-year-old male who came in with loss of orientation, difficulty ambulating, just not acting himself. And looking through this head CT quickly, we see a couple things. One is there's a large abnormality here, and this is the primary abnormality. Now, we won't go into a lot of detail about this because the focus here is thoracic imaging. So you can see, though, that there are low attenuation areas which represent edema, and there are areas of higher attenuation, meaning higher even attenuation, brighter, whiter, higher attenuation than areas of cortex. So that would suggest something that has hemorrhage in it and that has surrounding edema and quite a bit of mass effect. This potentially could be a primary brain tumor, such as an astrocytoma, especially a glioblastoma, GBM. But we always are suspicious whenever anybody comes in and they have a first diagnosis of a brain tumor, and if there's any chance it might be a metastasis, we immediately think of lung cancer. So we go, and let me see if I can, there we go. Let me size this down and bring it down, and here is the chest CT. Very impressive abnormality in the left hilar region. Always remember that it's important that you use a proper terminology and that you clearly and succinctly describe if there's an abnormality and where it is. So a good starting statement is there is an abnormality in the left hilar region. It's something of which you are sure, and we go from there. Now let me enlarge that a little bit. Here we have an axial image showing the same thing. At first it almost looked like it was inside the pulmonary artery, which would make it a pulmonary embolism. It looks like it is significantly compromising the pulmonary artery there. Let's see, but not entirely. So it's a mass in the left hilar region. How do you put the two together? Mass in the hilar region and a brain tumor with a lot of mass effect. That is not uncommon for lung cancer. Lung cancer often presents, symptomatically at least, with brain lesions and brain symptoms and signs. So go back to the coronals here, and let's see if we can change the color of this a little bit. There we go. So we look around. The masses in the hilar region would make me initially think that this is adenopathy. It could be adenopathy in there, although I don't see discrete nodes. It could also be the primary lung tumor, the bronchogenic carcinoma. So looking at the lungs, we look to see if there may be a small lesion, maybe a specific localized nodule elsewhere in the lungs, and that would account for this possibly being hilar adenopathy. But we don't see that here. We don't see a peripheral mass in the left lung. The only thing that we see that's clearly abnormal is this left hilar mass. Well, that would suggest to me that this is a primary bronchogenic carcinoma, lung cancer, and as the term bronchogenic suggests, it emerges from bronchi, and there certainly are bronchi and bronchial branches in the hilar region. Let's see if we can show you that patency. Now here you can see the main pulmonary artery comes out of the right ventricle. Here's right ventricle and left ventricle in the coronal image. That's why the right ventricle is called right, even though there's a lot more difference between the position than right and left when it comes to the ventricles, but it is more rightward. It's also more anterior, and that's why the main pulmonary artery, which emerges from the superior aspect of the right ventricle, courses up and back and then branches to the right and to the left. The left is more posterior, and I usually emphasize this reality by going through a pose, and maybe you'll be able to see this, but so the bronchi basically come out straight like this. Okay, so the bronchi stick out to the sides like this. Now the right pulmonary artery comes right off to the right, kind of in front of the right main pulmonary artery. The right the right pulmonary artery is right in front of the right mainstem bronchus, that is. So the bronchi are coming out like this. The mainstem bronchi are coming out like this. So you have the right main pulmonary artery going like this, but the left main pulmonary artery instead does this, kind of comes up and over. So this awkward position is designed to encourage you to retain in your mind's eye that the pulmonary arteries do not come out from the mediastinum like this. The bronchi more or less come out like this, but the right main pulmonary artery goes like this in front of the right mainstem bronchus, and the left comes up and over and around. Very important thing. So when you see a lateral view, you will see a C loop like that, which constitutes the left main pulmonary artery. And we can see that here by going posteriorly and seeing that this vessel here has dived back posteriorly, whereas on the right it goes more directly down. Here it's going down on the right and it's going back on the left. This, of course, is the aorta. This will start to get you a little familiarity with the anatomy of the mediastinum. So here you have a mass, and this is bronchogenic carcinoma. Let's look at the subsequent imaging study of the brain, an MRI brain. And here you can see this dark signal on this particular GRE study, which is typical of hemorrhage. So anytime there's hemorrhage, it's usually low signal on GRE. I'm not going to ask you that, but just to expand your horizons a little bit. This is a coronal image showing you very clearly the mass itself, and additionally the significant surrounding brain edema. It's called vasogenic edema. That's the general type of edema that accompanies tumors. And let's see, here we have a T1 weighted image, and generally they will do a T1 weighted image with gadolinium. Let's see if we have, not that. I think this is it. T1 weighted image with gadolinium. Okay, so now you can see the abnormal enhancement and the irregular contour of this mass. So what we have then is this is a bronchogenic carcinoma, left hilar mass that proved to be a metastatic or metastasizing bronchogenic carcinoma to the brain, metastases to the brain. And there's some other interesting things here, like mass effect on the brainstem. You can see how it's pushing against the brainstem. But the primary matter here is that it's a pulmonary mass. It's evident in the hilar area. And you have to think of a number of differentials, Learning Radiology, the book, as well as the iPod or the podcast or online will give you a nice brief differential of those, and I encourage you to look at that closely. Let's take a last peek here at the coronal or sagittal images. So here we are coming on the sagittal images. And it gives you a pretty nice depiction of what we have here. So we're going out and we come in. You can see the bronchus here, the right main stem bronchus coming out. I'm sorry, it is the left main stem bronchus. It's coming out and it divides into right upper lobe and right lower lobe bronchi, and this one looks like it's narrowing there, and then it's completely occluded. So what's a little surprising is that at this point, this patient doesn't have left upper lobe atelectasis with an occluded left upper lobe bronchus. Okay, so here again, I want you to see that the aorta comes out from the middle of the heart and arches up as the aortic arch, like that. The pulmonary artery, however, emerges from the right ventricle. It is more rightward, but importantly, it is more anterior as well. So here you can see the pulmonary artery emerging from the right ventricle, coursing up and back, and subsequently bifurcating, branching beneath the aortic arch. So you'll see that here is, that's the right main pulmonary artery, and then over on this side it gives off the left main pulmonary artery. Okay, so just some anatomy and an interesting, although unfortunate, case. That's it.